Lots to know about coronaviruses. Coronaviruses are types of viruses that typically affect the respiratory tract of mammals, including humans. They are associated with the common cold, pneumonia, and severe acute respiratory syndrome (SARS) and can also affect the gut. A coronavirus was first isolated in 1937 from an infectious bronchitis virus in birds that has the ability to seriously devastate poultry stocks. These viruses are responsible for between 15 and 30% of common colds. Over the last 70 years, scientists have found that coronaviruses can infect mice, rats, dogs, cats, turkeys, horses, pigs, and cattle, mostly which are consumed in China. Now, some fast facts on coronaviruses. Number one, there is no cure for the common cold. A coronavirus causes both SARS and MERS. Coronaviruses infect many different species. There are 6 known human coronaviruses. SARS spread from China to cause infection in 37 countries, killing 774 people. So what are coronaviruses? The human coronaviruses were first identified in the 1960s in the noses of patients with a common cold. 2 human coronaviruses are responsible for large proportion of common colds, OC43 and 229E. Coronaviruses were given their name based on the crown-like projections on their surfaces. Corona in Latin means halo or crown. Among humans, infection most often occurs during the winter months as well as early spring. It is not uncommon for a person to become ill with a cold that is caused by a coronavirus and then catch it again after 4 months later. This is because coronavirus antibodies do not last for a very long time. Also, the antibodies for one strain of coronavirus may be useless against other strains. Now let's talk about the symptoms. Cold or flu-like symptoms usually set in from 2 to 4 days after coronavirus infection, and they are typically mild. The symptoms include sneezing, a runny nose, fatigue, a cough, in rare cases fever, a sore throat, exacerbated asthma. Human coronaviruses cannot be cultivated in the laboratory easily, unlike the rhinovirus, another cause of the common cold. This makes it difficult to gauge the coronavirus impact on national economies and public health. There is no cure, so treatments include taking care of yourself and over-the-counter medication. Rest and avoid overexertion. Drink enough water. Avoid smoking and smoky areas. Use a clean humidifier or cool mist vaporizer. The virus responsible can be diagnosed by taking a sample of respiratory fluid such as mucus from the nose or blood. Now, coronaviruses can spread in the following ways. Coughing and sneezing without covering the mouth can disperse droplets into the air, spreading the virus. Touching or shaking hands with a person that has the virus can pass the virus from one person to another. Making contact with a surface or object that has the virus and then touching your nose, eyes, or mouth. On rare occasions, a coronavirus may spread through contact with feces. It is said that mutating abilities of the coronavirus are what makes it so contagious.